Hey, um, I just wanted to make a video just to um, explain a little bit about laryngomalacia and acid reflux, commonly known as GERDs in infants. My daughter here of soon to be 3 months, um, she has both. And I just wanted to briefly go over symptoms and treatment that I have been told, as well as treatment that I kind of home remedies myself. Um, well, first off, I just want to say that you are not alone. Okay, I am a first mother. This is my first child, and it's scary. Yes, I'm constantly checking on her in the middle of the night, and it's something you just have to work around. So don't think you're alone, because trust me, you're not. First off, she was born on July 5th, and before she was born, they realized that she had meconium, which is basically the first bowel movement of an infant, but she was still inside the womb. So that actually right there is or can cause um, laryngomalacia. Now, what is laryngomalacia? Laryngomalacia is basically a undeveloped, or not, I don't want to say undeveloped, underdeveloped, um, immature, there we go, immature voice box where it should be nice circular like so, when it's kind of oval shaped, which is causing kind of like a flap over each other where she's breathing or eating or any type of physical activity that she is doing at that current moment. So, with that being said, that's what laryngomalacia is. Something that they will grow out of. There, at severe cases, surgery will be done, but that's up to the doctor. Um, right after her birth, and she was rooming in with me, I noticed that she was very raspy sounding. I'm pretty sure at the beginning of this video, you heard her when she was breathing. That's normal. She sounds like that every day, all day. That's how she sounds when she breathes, and it should not be like that. That is another indicator that something is not right. I don't know if you heard that, but yes, she did it. So that's another sign of laryngomalacia. Um, Another sign of laryngomalacia is not a proper gain weight. After her very first appointment at the pediatrics, she was seen 2 weeks later, and between those 2 weeks that we came back, they noticed she only gained less than an ounce. Infants should be growing or getting an ounce a day, maybe even more, and she in 2 weeks did not gain barely an ounce. That was heartbreaking for my mother. So I was breastfeeding, and it was heartbreaking. So long story short, they rushed us to the hospital because they noticed that her rib cage was coming in, as well as in her throat area. She was doing one of these, and I could show you, but let's see. You want to look in your child's throat area? Okay, she doesn't want to show, but she smiled. But basically, it will cave in more than the norm. It's just an indicator that she is struggling to breathe. So we went to the hospital. They did an oxygen count, and she was fine as far as getting her oxygen, but it wasn't until a few weeks later when we referred to an ENT specialist that she had laryngomalacia. They actually did a scope down her throat and seen that it was very irritable and red. So with that being said, they actually put together that if she has laryngomalacia, she has acid reflux. Not all babies have both, but usually if you have laryngomalacia or acid reflux, usually they have the other one. It's kind of like a peanut butter jelly effect. You can't have peanut butter without the jelly, unfortunately. So in this situation, she does have both. Basically, what acid reflux is in infants, GERDs, It's the same thing in adults. It's heartburn. It's some type of, it's just not agreeing with her stomach, and it'll shoot right back up. And either it will just sit in her throat right here, or it will come up. Either one, it really irritates her laryngomalacia here with the swelling, irritability, and actually can cause it to be worse. So if you can get one fixed, you can get the other fixed. So we just recently had an appointment to where they did a swallow study. They used barium, and they actually showed her drinking it, and went down, and you could see it as soon as it hit her stomach, maybe barely 2.5 ounces, it shot right back up, and it was just sitting in her throat, and you could hear the sound, and it made perfect sense. So we were referred to use Folex, not Folex, sorry, scratch that, not Folex, Zantac. Zantac we were given for medicine. She takes twice a day, 1 milliliter at a time. I do see some help in it, but you have to be consistent with this medicine. This medicine doesn't help like that. It takes about maybe a week or so for it to really show an effect. If you're not big on having your child on medication, I completely understand. I was not for it at all. I wanted to stray from medications as much as possible, but I had to realize that this is not me. This is my daughter, and if she's in pain and there's medication that's not harmful, if there's a way to help her, most definitely I had to kind of get my pride out of that. So talk it over with your doctor if you feel any of these symptoms that I had described. And actually, I have a few more. Some of them that are very obvious are she does not like to lay on her back. That is a complete no-no. Do not lay her on her back. She will fight it to the end of the day. The only time she's on her back is when we're changing her diaper. Any other time she's sitting up being held. She's in her little seat when when she wants to chill, have a different view of the house or something, or she's in her rocker. I don't believe y'all can see it. So we got recommended for by our pediatrician that it is okay for her to sleep in her infant chair as long as we had something firm on the back of her head and her back. Just so that it wasn't, like she was sleeping on something soft due to the fact of SIDS. So she's been doing that since birth pretty much, and it helps a lot. As long as you burp afterwards. We also was told for her, because I had to switch to formula because she would not breastfeed and she wasn't gaining the weight she needed, I had to unfortunately slow down my breastfeeding. So she's mostly formula baby. I use Infamil, and we were given a Dr. Brown's nipple, which actually slows her drinking because they realized that when she was drinking, due to the laryngomalacia, it was getting into her lungs and causing her to choke. That's another sign of laryngomalacia. That's a huge sign. So if you ever hear your baby drinking or scarfing down some milk, and it's an everyday constant thing, not just once every while, but it's all the time, and your baby is choking and start coughing and milk come out the nose or the mouth, and you can tell that they're struggling to breathe, that's a huge sign of laryngomalacia, and I would tell you to go to the doctor and let them know so they can get you the proper treatment and head you towards the right direction for your child. I also noticed she will arch her back like this, or she would be very fidgety. She would just cry in the middle of her sleep. She would be down for hours and just bam, she'll just start screaming at the top of her lungs. And that's actually another sign of acid reflux, GERDs. Um, just one of those things. And it's tiring. It's exhausting. I know it's exhausting for her as well as your child. Um, I just want to let you guys know that if you have any of these signs, most definitely do not hesitate to call your doctor. I call my doctor and ask them everything under the sun. If something does not sound right, I'm going to ask. I want the best possible treatment for my daughter to make her feel as comfortable as possible. Um, is there anything else? I'm first off, I apologize if this video is too long. Sorry. I just want to really get you guys to know that this is what's going on. It's something that went unnoticed for a long time. There is no really cause. As far as the laryngomalacia, they don't actually have a reason why some babies are born with underdeveloped voice box area. Is one of those things. They do believe it is hereditary, so you might want to do some digging. But I mean, it really doesn't matter as far as treatment. It's just one of those things you just kind of have to deal with. Usually, both of these symptoms they grow out of them no more than 18 months, 2 years. I know that's a long time, but it will get better. I keep telling myself that it will get better. I also want to inform you guys that also it does get worse around 6 months or so. That's where they become more mobile in a sense, more trying to crawl, trying to walk. So the more energy they use, the more that they're needing to breathe. And because of that, floppy voice box is causing them to probably get a little bit more shallower. So don't freak out if things kind of go a little left a little bit. That's actually normal because of that fact. Just kind of take things really slow. Also, a home remedy that I do that actually works really, really well is I do not let her cry just to cry. I know some babies and some people let their babies cry because they're just fussy at that moment and they'll quiet themselves down. I do not. If she does not have, or if she did not have these symptoms and laryngomalacia as well as GERDs, I probably would just okay, let her settle herself down and see if it works. But because of that fact, she does have both of them. I do not just let her cry just to cry. I do not. I notice that when I'm holding her, when she is being shown attention to, is actually in a sense helping her. Even though she's in pain, it's keeping her mind off of the fact that acid from her stomach is burning her throat hurts because she can't breathe. It kind of eliminates a little bit of that distraction by me just being there or just doing something with her as far as making faces or talking to her or just, kind of bouncing her in her seat. Eventually, if she's tired, she will go to sleep on me a couple of times. So don't fear, oh, I'm going to hold her all the time. She's going to get spoiled, or he is going to, constantly want me there. Not necessarily, because when she wants to go to sleep, she goes to sleep. I also recommend, because I am a full-time student, I'm in the Army Reserves, as well as I work part-time. So I am a very busy mom. And I'm a mom full-time, so I'm very busy. So having to, hold her all the time to make her feel comfortable can get kind of too much at times, but it helps, and I will recommend it all day, every day. So I use one of these. It's a baby born. It's one of those baby carriers. It doesn't necessarily have to be this brand, but anything that you can hold and carry your baby in. I will put this on in the house, if I have things to do and I cannot sit down and just relax with her, if I have homework or something to do, I will wear this around the house. I'll put her right in, depending on which way she wants to face, and do what I gotta do. She's calm because she's with me. She can hear my voice, so that calms her. She's laying on my heart, so that calms her as well. And yes, I would most definitely recommend that. So yes, this is a number one. So I'll probably end my video with that. If you guys have any comments, please don't hesitate to comment down below. Like I said, I am not a doctor. I'm just a mother who is going through something that a lot of mothers are probably wondering who else is going through this with me, because I'm completely scared out of my mind. I don't know what to do. Am I doing something wrong? Did I do something wrong for her to feel this way or for her to have this? Don't stress yourself out about it, because it's not your fault. You're doing everything you need to do. So with that being said, everything will be okay, and just enjoy your time with your son or daughter, and just get all the information that you need and treatment, and pray. So thank you for watching, and I hope you guys got some information. And once again, I'm sorry it's a long video. I just wanted to make sure you guys got everything that I know. So thank you, and